Hi, Dr. Kelsey. I'm going to be demonstrating the glaucoma exam. This is my patient Allie, and first we're going to start with the palpation part of the exam. So we're going to check directly for to feel if the eyeballs are harder than usual. They should be soft like a grape. So we would actually directly palpate the eyeball, well, over the eyelid. So patient, can you close your eyes for me? Thank you. And so we're just going to push and just feeling the hardness of the eyeball. The patient, I would ask the patient beforehand if she was wearing any contacts, just to make sure that we don't move that around. And then we'll move on to the shadow test. So I'm going to bring the pen light up and just have it straight across her eye level, and we're going to bring it forward so it illuminates the iris, and we're going to do that on both sides. And so in a patient with glaucoma, there would be a shadow on the medial side of the iris that would indicate that it's being pushed out by the increased pressure, and that would cause the medial portion of the iris to not illuminate. So this is actually an indicator for closed angle glaucoma, which is a more fast progressing, more serious condition that's an immediate emergency referral. So now that we've done that, we're going to do the confrontation exam to check the patient's peripheral vision. One of the first signs or symptoms that a patient has glaucoma is they start to lose their peripheral vision. So the same test from the cranial nerve exams. So patient, I'm going to wiggle my fingers, and I want you to tell me when you can start to see them, okay, in your peripheral vision. So, can you see my fingers right now?
I can see your hands.
You can see my hands?
Not anymore.
Okay. Just tell me when you see my fingers wiggling.
I see them now.
Okay, good.
I see them now.
Perfect. One more.
I see them now.
You looked.
No, I didn't.
Okay, patient's peripheral vision is intact, which is a good thing. So now we'll move on to the short fundoscopic portion of the exam. So for this, we're looking at the patient's cup and disc, where the optic nerve enters the eyeball. And so typically a healthy eyeball has a cup to disc ratio of 1 to 2. So if we see an increase of the cup size versus the disc, that could indicate some possible increased pressure in the eyeball. So we will turn on our, oh, that's shining me in the face. Okay, turn on our scope, and I'm going to use my left eye to look in the patient's left eye. Okay. So first we want to get the red response. Good. And now, patient, I want you to look slightly up, and slightly down, and slightly to the right, and slightly to the left. Okay, we'll do that on the other side. Okay, I don't want to block the camera. Go. So, this side. I think I might have used the wrong hand.
Mm-hmm.
Alright. So look up, and down, and to the right, And that completes the glaucoma exam. Thanks for watching, and we'll see you in lab next week.